My name is Tony Hout. I live in Dawsonville, Georgia. I was diagnosed with Cushing's syndrome, ectopic. I was in my right lung. Um, and uh, as far as now, it's been removed and I'm supposedly cured from Cushing's.
My name's Michelle Hout, and I'm Tony's wife. We've been married for 15 years, and we have 3 kids. Our oldest is 15, and then we have a 10-year-old girl and a 3-year-old little boy.
I guess it was 2011. I just started putting on weight significantly. I mean, I think I gained 50 pounds in 6 months. Started having a lot of injuries at work. I'm a contractor, so it was just a lot of dislocating ankles and falling and just, things like that. When I went to the doctor over it, there was the weight gain was contributed to just recently quitting smoking. The injuries were your body's adjusting to the weight gain. It's all these, just different things like that. And so we just kind of dealt with it for, gosh, maybe 6 months or so. And then I had a minor procedure at the same doctor, and I had to take my shirt off. And when I took my shirt off, he paused for a minute, saw all the striata, I think that's how you say it, and just said, "I think you have Cushing's." And I said, "What's Cushing's?" And so he kind of briefly explained it. He said, "I need to do some blood work, and we'll see what comes back." We did all the normal blood work that you would get, the metabolic, all the stuff, and my cortisol levels were high and all of that. So he referred me to an endocrinologist. We happened to be able to get into one fairly fast because of her mom. And so I guess within a couple of weeks, I went to see her. She went through the whole thing with the urine test, the dextro suppression test, the more blood work, and then it all came back, that I had Cushing's. So she diagnosed me. And then, ironically, a few weeks later, there was a conference at Emory, and she ran into Dr. Wakamescu, I think it's a tough one to say, explained to her my situation, and Dr. Wakamescu said, "Well, send him to me." So my journey was kind of quick. It actually, from the day he said, "I think you have Cushing's," to the day I got to Emory
6 months.
was within 6 months. I mean, it was fast. And then, tracking it down became the difficult part. They did, let's see.
They started out with MRIs.
Yeah, all the basic stuff. They went straight to the pituitary because that's the first place to
the
look.
IPPS.
And, they did, and they started from there and never could find it, wasn't in adrenals. Eventually it was the osteotype scan, I think they call it, I forget how to say it, that located in my lower right lung. And then it was some type of carcinoma, I forget the first word, but it actually produced the ACTH on its own. So from there, it eventually grew, produced more, got my pituitary to shut down, and then it took over and just went rampant, shot off the cortisol and then everything else. But from the time they found that, 2 weeks later I was having surgery. I was lucky enough to get a new type of surgery where I was home in 24 hours, and they were able to get it all. And so the tumor's gone, and so I say I'm supposedly cured from Cushing's. I still have a lot of leftover issues and problems since the Cushing's, but the tumor hasn't come back, and it's been 7 years now or so, and all my blood levels are normal on that level, is related to the Cushing's. As far as setbacks go, through recovery and, since all of that, I haven't, physically been able to get anything back. I can't get, my strength back, my stamina, I get winded real easy. I'm just, I get worn out constantly. I mean, it doesn't take much, the injuries are still a common thing. I mean, I just not too long ago dislocated my ankle, fell into just got bruised here, cut here, and all that just from stopping and turning around. So it doesn't take much. And then, it seems like, your brain is ready to do all these things, but your body just says, nah, not going to happen. And that kind of seems like a common theme for me, where I just can't seem to get it. That's kind of the biggest thing, the biggest setback I have. And that, and it relates to personal life, going and doing something with your family on vacation or on the weekends. And, you crave that weekend so you can just not do a thing, because you've suffered so much all week just trying to make it through.
He wants to work, but then
I enjoy it.
Yeah, and then he does work, and then he'll say, I feel like a train ran over me or a car ran over me, and then he pays for it for days and days and days after, from just doing something little, and then, and then he hurts when he doesn't do anything. So
it's just loss of motivation and energy to do things. Yeah, you just rather just nothing. You feel like you're withering away. It affects every little aspect of your life that you just don't think it will. When I was diagnosed and started, telling family, telling friends, because you don't even really know what to say, because you don't even understand the disease, first off. And then, you're trying to figure out a way to explain it to someone, but they don't see the inside of it. So they see, you're getting, I see you putting on weight. My friend here did this diet. You should give it a shot, or, well, if you're feeling weak or winded, maybe you should exercise a little more. Have you thought about joining a gym? And it's like, yeah, I thought about it. And then I thought about the broken bones I would get from trying to do that. I don't think, people really get it. You don't, because you don't really look like, for example, being, say, a typical cancer patient. If you tell someone, well, I have a tumor, they say, well, why are you so big? Most people I see are frail, and so they have this image in their head, these preconceived notions, so they chalk it up as to you don't really know what you're talking about, and this is kind of a thing I've never heard of. My horse had it one time, or that's always a fun one, and and then even, and she can speak better than me, but on this, but, it takes a while for even your closest, your wife or your husband, your kids to see, how you kind of start backtracking.
it just changes you. He's not the same person he was. And it's sad. I still love him the same, but it's so sad. It breaks my heart.
Yeah, I don't make it easy, that's for sure. When she's trying to help me out and do things for me, I certainly don't make it easy, because my outlook is so negative. And so, when she comes in and tries to do things to, even, trying to get me to go to a doctor, and I'm thinking, why? I've been to about 80 of those. I've seen the hand toss more times, you'd think it was a basketball game or something, but,
And even the medicine, if I say, do you take your medicine? Well, yeah, why do you need to ask me? Or, yeah, of course, but, then it's like, did I take my medicine? And then I'm like, well, let's go check. And then he's like, no wonder why I was feeling so bad. And, so it's good when it's like, oh, yeah, thanks for reminding me. But if they do it, then you're like the worst person.
Leave me alone, I can handle myself.
Right.
It's,
It's when I feel like I'm dying inside. That just breaks my heart. And, I worry about our kids and if they may get it or what they see. And if our oldest that's been through everything sees that he's having a bad day, he'll become really clingy, and he'll come and just give him a hug for no reason and give him a kiss, and he'll go outside, and he likes to sit outside because it's so quiet, and our son will go out there and just sit and talk to him for no reason. And it just, just, I just wish there was help that could really understand. And most doctors don't know anything about it, and they just make you feel like you're alone.
When I was first diagnosed with Cushing's, the coordination in the care that I received was actually better than I thought it would be. But I went through a really fast process. It was, one doctor referred me to the endocrinologist, that doctor referred me straight to Emory, and then they were, of course, because it's Emory, worked together on everything that they did. So I feel like I was one of the lucky ones from what I know about, what so many others have been through. So that part of the care was amazing. I mean, it was fantastic. Now, for the recovery part of it, there's zero coordination. I mean, I was diagnosed just from some off blood work, for an example, by 2 different doctors within about a 10-day period apart with leukemia, then not leukemia, it was lymphoma. Then no, you don't have that, but you still have something wrong. We just can't figure out what. And so, back to, leftover problems from Cushing's, but no doctors can come to they don't even hardly talk to each other, and then if you can get someone to email or send over something to another, I mean, it's like pulling teeth to get it. But then when they do get it, then they're questioning, well, why did they test for this? Why didn't they do this? And it's, there's no real system to it. And so, you have to try to go out. I mean, even I've had doctors tell me, well, here's a list of 4 or 5 possibilities that you might have now. These are all degenerative diseases. So go research them and see which one you think you might have, and then come back to me and we'll do some tests. And it's kind of like, I didn't go to school for this. That's what we're here to see you for. And so, and that's the kind of responses you get. It's kind of like, well, you go find your own problem, and then we'll check it if we deem it worthy. They call it recovery, but it doesn't, you're not recovered. So I'm not, I guess, I really don't know what recovery is, I guess, is a way to say it too,
Going through the process, I think, was a lot easier than dealing with the after effects as like now. The doctors do give you a lot of hope, but it's just false hope. It's not just cut and dry. You're going to have the surgery and you're going to be better. It's not like that. And, I wish I had something to say for hope, but I really don't have anything. The only thing I would be able to say is just don't give up. When the patient, your husband, your spouse, your kid, whatever, just, they might complain and get mad at you, but let them get mad at you, because they're worth fighting for and taking them so that you can try to figure out what is wrong. And maybe that doctor will have the answer. Even though we're 2 separate people, I go through it with him. And so I love him, and I care so much about you, and I just want you to feel better. Hopefully. And he does a good job hiding it a lot.
One word before I got sick to describe me would probably be energetic. One word to describe me during my diagnosis would be optimistic. One word to describe me now, frustrated. I think that's probably the best word. If you're a new patient, Lee, who's been recently diagnosed, I would say be persistent, but be patient.
One word that I would describe Tony before he was diagnosed is that he was happy. One word I would describe how this journey has been is awful. And I hate it. To describe now is I'm just nervous all the time, because I just don't know how to fix it. And his pain is awful. And the lasting effects, and no doctors know how to fix anything. And so he deals with it every day. And then I make doctor's appointments with all these specialists, and they just throw their hands up at him, and they don't believe him. For someone that has been recently diagnosed with Cushing's, I would say to not give up. Make appointments with everybody. Even if the one specialist tells you that nothing's wrong, go to another one. And just, even when they don't want to go, you just make them go to the doctors until you find something. I would say for families going through Cushing's, to involve their children, but to an extent. Our son was like 5, maybe? 5?
Yeah, something like, well, maybe 7.
And he's been through everything from the hospital to the doctors to helping watch his sister while we went to the doctors. And I believe that your children get more compassion from watching you go through it with your spouse. It's a good thing, and then it's a bad thing because of the reality of it.
I wouldn't tell them, the details.
Right.
You don't want to scare your kids, but you also don't want to lie to them. You let them know that, there's something going on and, we're getting it fixed, that type of thing. Because keeping it a secret from them, they're not stupid, they'll know. And, but just, ask everyone that is involved, everyone in your family to try to understand that you're going to have bad days and they should be expected. And so just to try to give you a break, kind of cut you some slack. And that might be a good.
And just try to understand. You can't fully understand Cushing's if you're not the patient. But, just try.